Hello, good morning. Myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department in RPIIT, Technical and Medical Campus, Karnal. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in the last presentation, we're discussing about the neurological assessment. So in this, we will discuss about the cranial nerve examination. So for cranial nerve examination, the equipment needs are tongue depressors, flashlight, sugar and salt samples, watch, cotton tipped swab, Snellen chart, ophthalmoscope, samples of familiar odors, and tunic fork. So first cranial nerve is olfactory nerve. So this nerve function is to smell. So for cranial nerve first examination, the sense of smell is tested by having the patient occlude one nostril and close his or her eyes. The examiner then takes a non-irritating substance and place it near the non-occluded nostril. Patient is asked to identify familiar odors. Commonly used are coffee, tobacco. So each nostril is tested separately. So repeat the process for the opposite side using a different scent. Next is cranial nerve second, which is optic nerve, which main function is to vision. So the optic nerve testing includes assessment of both visual acuity and visual fields. Each eye is examined separately while the patient covers the other one. Visual acuity is tested by having the patient read a Snellen chart from 20 feet away. Have the patient start with one eye covered and read the lines from top to bottom, that is largest to the smallest letter. Record the lowest line that the patient can read with 50% accuracy. Next is cranial nerve third, which is oculomotor. So for oculomotor nerve testing, test for eye movement toward the nose. It inspect for conjugate movements and evaluate papillary size and test for papillary reactivity to the light. Inspect ability to open eyelids. Next is the trochlear nerve, which is the fourth nerve. For trochlear nerve testing, test for upward eye movement, inspect for conjugate movements and the nystagmus. Next is the cranial nerve fifth, that is the trigeminal nerve. For trigeminal nerve testing, steps are also the trigeminal nerve is the largest of the cranial nerves. So in this, firstly, the patient should have his or eyes closed during the testing procedure. Touch cotton to forehead, cheeks and jaw. Sensitivity to superficial pain is tested in these same three areas by using the sharp and dull ends of the broken tongue blade. Alternate between the sharp point and the dull end. Patient reports sharps or dull with each movement. If responses are incorrect, test for temperature sensation. Test tube of cold and hot water are used alternatively. So while patient looks up, lightly touch a wisp of cotton against the temporal surface of each cornea. A blink and tearing are normal responses. Third is, has patient clench and move the jaw from side to side. Palpate the masseter and temporal muscles, noting strength and equality. Thank you.